I am Wiedenbach from Wiedenbach, and today I will be performing rectal installation.
Gather equipment. Check medication order against the original physician order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport medications to the patient's bedside carefully and keep the medications inside at all times. Careful handling and close observation prevent accidental or deliberate disagreement of medications.
Ano pangalan talaga?
Identify the patient by checking the name and identification of the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and help prevent errors.
So kung ma-perform ta rectal installation, tutanta mo lang yung mga puti. Okay?
Explain procedure to the patient to gain cooperation and to allay anxiety. Perform hand hygiene and wear gloves to prevent the spread of microorganisms. Assist the patient to his or her left side in a seamless position. Drape accordingly to only exposed buttocks. It allows for easy access to anal area. Left side decreases chance of expulsion of the suppository. Proper draping maintains privacy. Remove the suppository from its wrapper. Apply lubricant to the rounded end. Lubricate the index finger of your dominant hand. Lubricant reduces friction on administration and increases patient's comfort. Separate the buttocks with your non-dominant hand and instruct the patient to breathe slowly and deeply while the suppository is being inserted. Slow, deep breaths help to relax the anal sphincter and reduce discomfort. Using the index finger, insert the suppository round end first along the rectal wall. Insert about 3 to 4 inches. Suppository must make contact with the rectal mucosa for absorption to occur. Use toilet tissue to clean any stool or lubricant from around the anus. This to prevent skin irritation.
Stay in a position ta for 5 minutes.
Encourage the patient to remain on his or her side for at least 5 minutes and retain the suppository for the appropriate amount of time for the specific medication. This to prevent accidental expulsion of suppository and ensures absorption of medication. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Assist the patient to a comfortable position. This ensures patient comfort.
Thank you.
Evaluate patient's response to the procedure and medication. The patient needs to be evaluated for any adverse effect from the medication or procedure.